Thanks for tuning in to Vital Motion Podcast. Let this be a place to grow your mindset and prioritize movement. All audio is original with music and production support from Riverside as my editing platform. This podcast is for education and inspiration only, and any studies or products I mention are simply for context. Take what fits into your life and check in with your healthcare medical providers as you feel is necessary. Thank you so much, and I'd love for you to like and subscribe to my channel. Happy listening.
Welcome back, listeners, to this week's pod episode. Today we have Abigail Atkins, a good friend of mine in the PT program, and I thought it would be fun for us to do this episode to talk about the four horsemen's diseases, and which does include cardiovascular disease, Alzheimer's, diabetes, and cancer. So we're going to get into it, have a good little conversation. So yeah, what's up, Abigail? How are you doing?
Hey, I'm good.
Is there anything you want to tell the listeners about yourself?
Yeah, so just like general background on me, through like high school and everything, I wanted to do nursing, and I went to James Madison for my undergraduate, like Madison as well. So I was nursing, but then I switched to psychology, and then I finally decided on health sciences with a pre-physical therapy minor my sophomore year. And then since then, I finished up, I took a gap year, and then I came to Old Dominion for PT school. I actually start my clinical rotation tomorrow. By the time the pod's out, I'll be in it. So I'm really excited. But yeah, that's pretty much it. Yeah, I have an interest kind of in more inpatient or acute, maybe neuro physical therapy right now. So yeah.
Awesome. Thank you for sharing. So we're just going to dive into the questions. We're going to talk about how we learned about these four horsemen's diseases in school and start with kind of what are some early warning signs that you may feel with chronic diseases.
So basically, if you are developing a chronic disease, obviously you might not know right away, but some signs would be like any kinds of extreme fatigue. Inflammation is a huge theme in chronic disease, which we'll talk a little bit more in depth about. If you're having any type of chronic pain or you're noticing bodily changes, so that can be like a loss of appetite or weight loss that's not explained by activity or diet or anything. Yeah, I feel like those are some basic warning signs. They don't necessarily mean that you have a chronic disease for sure, but it's something to monitor and be aware of. Primary prevention is really important for identifying these, as well as secondary. So primary prevention is just basically vaccinations, doing anything to avoid having sickness in general, avoiding tobacco products or having alcohol just in moderation. Secondary is when you're getting blood pressure checks regularly, mammograms, regular blood work. So these are really important. And if you're noticing any of these symptoms, like the extreme fatigue or anything like that, definitely talk with your PCP because it's important to monitor how you're feeling day to day.
Yeah, definitely. You hit a lot of good bases there. The only other thing that I had on my list was any kind of GI issues or discomfort with that. I feel like it's just so important for us to be in tune with our bodies. And, if we are noticing something weird or funky, not just push it away and ignore it until it's too late. The next question that we have is, what role does inflammation play across all diseases, and how does that look?
So in class, we basically learned, our first semester in PT school was that inflammation is the common theme of all disease. Inflammation, we all know that word, but it's basically your body's responding to illness or something being out of the norm for your body. So that can be pain, swelling, flushed skin, abdominal pain. If you're having any fever, or it can even be mouth sores or eventually even depression for especially chronic inflammation. But there is acute versus chronic too. So acute is if you think of a cut in your finger or something, your body's going to rush to that area, the inflammatory cells, and they're going to begin the healing process. Or if you have the flu or strep throat, your throat's going to be inflamed. But for more chronic inflammation, you can think of rheumatoid arthritis, where the body continues to respond even if there's not a direct threat. So that can last up to months or years. And in RA, the cells are attacking the joint tissues, but there are a lot of other forms of chronic inflammation.
Definitely. Yeah, RA is really unfortunate, having that constant state of inflammation. It's when your body, and chronic inflammation in general is your body is like sending out these signals constantly, even if there's not necessarily any danger present in your body. So if we can kind of get that under control before it gets to that point, that would be ideal. Another thing that we may see is if you have an increase in visceral fat or fat around your organs. Now we do have a basis of like body fat that we have as females and males. But if you have an excess amount, then that would also lead to more issues as well. Moving right along, the next question that we have is why is cardiovascular disease the leading cause of death, even though most people know that exercise is important?
Yeah, I like this question a lot because I even like as a PT student, like I know exercise is so important in daily activity, but like sometimes you just get in a slump and it is so hard to like get back doing activity and stuff. But for CVD, it is a lack of more than just activity that might lead to it. So it can be your diet, if you're using tobacco products, it can even be like your environment with air pollution and stuff. And for those who might struggle to be more active or struggle to improve their diet, I think a huge part of that is it's hard to break habits, first of all, and harder to build healthier ones, but also it's expensive. Healthier choices are really, really expensive. Like fast food is going to be readily available to like everyone and it's cheaper. And sometimes going to the grocery store and getting healthier options is going to be pricier. Gym memberships are really expensive, as well as like if someone uses tobacco or if you drink alcohol regularly, these are both addictive substances and they're extremely, extremely hard to break these addictions. With that, it's important to be able to understand that you can still instill healthy habits on a budget. So like daily movement, like walks or runs or doing things outside like biking, those are all cheap and free most of the time.
Yeah, definitely. And like you said, I think us as in the healthcare system, I feel like it's so important for us to educate our patients. Like you were saying, that it doesn't have to be something complex. It can be just going outside for a walk or getting up every hour at your desk and moving around, just finding time to prioritize movement. It doesn't have to be some fancy Pilates class or like a kickboxing class or something like that. I mean, no, those are fun, but at the same time, movement is just the main thing that we want to try to encourage throughout our day. Sitting is the new smoking. So maybe you are, exercising for 30 minutes a day, but if you're sitting for the rest of the day, well, is that really encouraging like an active lifestyle, So I think it's just little movements throughout the day versus just one set time in the beginning or end of your day, if that makes sense.
Yeah. Even just dance. That's like my new favorite form of cardio. It's so fun.
Yes, we had a Just Dance tournament recently with some of our other classmates, and I must say it was a blast from the past. We had so much fun, and we were all like drenched in sweat
Yeah.
after. So definitely just, get creative with it for sure. What are some fitness markers that maybe people should be aware of beside of, just like your general BMI or weight that we typically see or I feel like is focused on?
Yeah, I think like really understanding, especially activity, like how winded are you feeling after you're taking the stairs or just even going on a walk? Are you really tired? Do you feel super out of breath? I feel like that's a good indicator because I don't like knowing my weight. I don't like knowing my BMI. And I know a lot of people are like that. It's really like been ingrained in us to be this negative thing. And it can be really hard to break that kind of social norm. And if you're improving your cardiovascular health, like you are going to notice, like, oh, I took the stairs and like I wasn't as out of breath as I was 3 weeks ago. Also, things like blood pressure, you can take your own resting heart rate and see if that's decreasing as you're increasing your cardiovascular fitness and blood pressure. You can just your regular checkups is usually when I think most people aren't taking their blood pressure every day like we are in PT school, but yeah, just at the doctor and stuff.
Those are all great points. I definitely think checking in with your body, especially, when you are doing your everyday activities, like going upstairs is a great way to see like, how am I truly feeling? Am I out of breath? And the blood pressure, I think, is a huge thing that is so underrated. So again, that just goes back to, I wish we were a little more of a proactive healthcare system versus a reactive system. All right, so now we're going to transition and talk about diabetes. And we wanted to start by defining like what is your metabolic health and habits that can damage that, and then may lead to like insulin resistance or before diabetes may be diagnosed.
Yeah, so metabolic health sounds similar to metabolism and they're related, but it is a slightly different kind of concept. So, like, metabolism is like our body converting food into energy directly, and all of that. Like, you think of, oh, I have a fast metabolism, so I might lose weight easily, or I have a slow metabolism, so I hold on to weight. But metabolic health is more about how it's the same as we're converting food into energy, but it's to maintain balance in the body and function. And it's influenced by like diet, sleep, your activity levels, stress, and even genetics. Like when people think, again, they might have a slow metabolism based on their genetics. And really, what's going to damage metabolic health, the things that I mentioned, the factors, if you're having poor sleep, high stress can really affect it. If you're not exercising as often, poor diet, those are all things that can damage your metabolic health.
Yeah, no, for sure. I think that was a good basis. So some helpful strategies maybe to avoid, some of the highs and lows in your metabolic health is not skipping your meals, pairing your carbohydrates with a protein or fiber. So just having like a well balanced versus just, eating mac and cheese for dinner or a girl dinner. Even though it is trendy and funny, it might affect things later on. And, just things like staying hydrated, especially with people who do have the diabetes. Obviously, you're monitoring your glucose pretty frequently to make sure that those levels are normal. Just overall recognizing like your common patterns of, you know, when you wake up, eating food, when you're hungry, being aware of that so then you can nourish your body and not just ignore those signs, because then that starts to lead to irregularities and your body might not pick up on, when you're hungry or when you're full, and then that just leads to other issues down the road. But for the most part, we're not pros in this topic, but I feel like
Definitely not.
but I feel like at least that just gives you like a common basis of what metabolic health is. And then we're going to talk about Alzheimer's. And it's probably one of the most unfortunate things that could happen to anybody. But what are some lifestyle factors that you found that may contribute to a cognitive decline?
It's going to sound repetitive, but stress, sleep, activity, diet, tobacco. I'm just spewing them out. Alcohol. I did find a study, and it is listed in our sources. It was done in 2024 in the UK, and it found that smoking was actually one of the largest factors. And for the people in the study that reported smoking, cognitive decline was faster, which I thought was really interesting and pretty scary. But it was really the biggest factor for all of those. But again, it's not a solo factor. They all work together.
Another thing that I actually found was just like social interaction too. I feel like a lot of people, as they retire, they're not as active in the community. And so that can kind of lead to a decrease in cognitive decline as well, because you're just not stimulating your brain. You're not necessarily learning anything new. So those are also some things to consider when it gets to that point later in life. And then what are just some good habits that we could instill for our brain health?
Again, repetitiveness, but physical activity helps literally everything. Like Madison said, like social activity, I also saw is so huge. Because with Alzheimer's, you really see the most atrophy in the frontal lobe too. And when we're having social interactions, that's what's working. We're making judgments, we're using thinking and reasoning. And so working that part of your brain with social activity and social interactions is really going to help, especially with aging and maintaining heart health. So coming back to our cardiovascular fitness and just our heart health in general. So getting your blood pressure checked, monitoring that blood sugar, and staying active. It's all very important.
Definitely. That was perfect. Again, this was just to kind of give just a general overview of all of this. The last little bit of questions we had is cancer more influenced by genetics or environmental factors? If you found anything related to that.
I found that it was definitely more environmental. There was a source that said that only about 5 to 10% of cancer cases and cancer deaths are solely genetic. I think it was cancer deaths, 5 to 10% were solely genetic. So again, it's going to be everything we listed that's going to affect it. I have a little bit of statistics, which I know are boring, but almost 25 to 30% of cancer deaths were due to tobacco in this specific study or source. And 30 to 35% were linked to diet, and then 15 to 20% were linked to infection, but then the remaining percent was due to other lifestyle factors. It's all linked, I feel like, which just I think shows again that regular checkups are really important.
Yeah, definitely. And then the last little bit is any warning signs that people may ignore for too long that should be more of a concern.
Yeah, I think one that I think about a lot is like with skin cancer. We learned in class about the ABCD rule, which is like with any spots on the skin, noticing if they're like asymmetrical, if they have irregular borders, or if they're changing color, spreading at all, changing diameter. That's all really important to pay attention to and to note. And that's, again, your provider should be looking for that. I get a ton of moles, so I know I need to go to the dermatologist probably and just tell them, although I haven't noticed any of that, which is good. But that's a huge one I think of because sometimes you also can't see it. It might be on your back or a part of your body that you can't access with your own eyes very easily. Another sign, like unexplained weight loss, like some people might be happy about that, so they don't really think of it as a warning sign. Unexplained fatigue, again, like it's not getting better with rest. It seems kind of random. Pain being like persistent, not explained again. It can't be reproduced, so it's not like musculoskeletal pain or anything. And then fever, like obviously if you have the flu or if you have some kind of infection, you're gonna have a fever, but again, like kind of like an unexplained fever where you're not really sure. And so many people have these signs, and it doesn't necessarily mean you have cancer. Again, we're not trying to freak anyone out, but it's just obviously important to understand your body and monitor your body.
Yeah, definitely. And I think just like with the profession we're in such a great spot because we are taught to look out for these red flags or signs that may not be right. Like she was saying, the unexplained weight loss or pain or, changes in your skin so that we can kind of help you in the next best steps or for you. Yeah, so that's all the questions we had for today. Thank you so much for coming on, Abigail. And yeah, we'll see you next time, listeners.
Bye.